Hello everyone, my name is Dr. Rakesh Patkar. I'm VP Healthcare of PlusCare International's Private Limited and Head of Department of Histopathology and Cytopathology. The topic for today is immunohistochemistry. So what is immunohistochemistry basically? Immunohistochemistry is an answer to a variety of questions. A question the doctor may ask, a question the patient may ask. For example, what type of cancer is it? Where has the cancer come from? Is it really a cancer or is it something which mimics cancer? How do we treat this cancer? Will the cancer recur? Is the cancer genetic? All of these questions can be answered quite definitively by immunohistochemistry, which we specialize in and pride ourselves in. Now let me give you two stories, two case scenarios. I received a biopsy of a breast of a woman, a young woman, comparatively young woman, and we did a immunohistochemistry panel and we classified it as a lobular carcinoma of the breast, which means the clinical implication is that she has a 20% chance it may recur in the other breast. So the doctor has to follow up and she also has to follow up with a mammogram regularly. Now, we went further ahead and we did hormone receptor testing. We found out that she has estrogen and progesterone receptors on the breast. So when we gave medicines to block these receptors, the cancer regressed and she had a complete remission and cure. So that is where immunohistochemistry completely changed and saved her life. We say that with pride. The second case was a woman who was a young woman. Her mother had passed away for a reason which she could not quite understand or explain. She was in the village at that time. This woman came with a breast lump and the biopsy which they was sent to us and we did immunohistochemistry, we found out something called a triple negative basal type breast cancer. Now these cancers, and also considering the fact that she was young and had a possible family history, told us we needed to go for BRCA1 testing. It's a gene testing which we do at PlusCare as well. Now if this gene comes positive, that means that she has a high chance of getting ovarian cancer too. Her relatives can get close first degree relatives can get breast and ovarian cancers, and the male relatives can get even prostate cancer. At the same time, if it comes positive, there are specific tailored treatments available for it, which the Food and Drug Administration (FDA) has actually approved. Sometimes it's difficult for a doctor to differentiate where a cancer has come from. You may find a knot in the neck, thinking that it may be just a cancer of the neck or cancer from the throat. But I have seen cancers coming all the way from the cervix all the way up to the neck. So the attention of the doctor is diverted in a different area of the body where they can completely cure the patient as well. At PlusCare, we ensure the highest quality control procedures for immunohistochemistry. We communicate our findings to the doctor and we do something called a MDT, a multidisciplinary team approach to malignancies and other similar conditions. So if you have any doubts about immunohistochemistry, about cancers in general, about how we approach the case, or if you want to discuss anything with us, please feel free to contact us. We're always available for you. Thank you.